Hi, I'm Avery. We're Team 2 for the Head and Neck School Project, and today I'm going to take you through some of the nervous system. Number 183 is the frontal nerve, and this is a branch of the ophthalmic division of the trigeminal nerve and provides sensory innervation to the forehead, scalp, and upper eyelid. It divides into the supraorbital and supratrochlear nerves, which carry sensation from these regions to the brain. Number 184 is the supraorbital nerve, and this is a branch of the frontal nerve that provides sensation to the forehead and scalp. It exits through the supraorbital foramen and carries sensory information back to the brain. Number 185 is the supratrochlear nerve, and this is a branch of the frontal nerve that provides sensation to the inner forehead and upper eyelid. It carries sensory information from this area back to the brain. Number 186 is the lacrimal nerve, and this is a branch of the ophthalmic division of the trigeminal nerve that provides sensation to the lateral upper eyelid. Number 187 is the nasociliary nerve, and this is a branch of the ophthalmic division of the trigeminal nerve that provides sensory innervation to parts of the eye, nasal cavity, and skin of the nose. It also gives off branches that supply the cornea, contributing to the corneal reflex. Number 189 is the pterygopalatine ganglion nerve, and this is associated with the pterygopalatine ganglion and helps carry parasympathetic fibers to glands of the nasal cavity, palate, and lacrimal gland. It plays a role in stimulating secretions like mucus and tears. Number 190 is the zygomatic nerve, and this is a branch of the maxillary division of the trigeminal nerve that provides sensation to the cheek and lateral orbital area. It also helps carry parasympathetic fibers to the lacrimal gland for tear production. Number 191 is the infraorbital nerve, and this is a branch of the maxillary division of the trigeminal nerve that provides sensation to the lower eyelid, upper lip, and side of the nose. Number 192 is the ASA nerve, and this is a branch of the infraorbital nerve that provides sensation to the maxillary anterior teeth and surrounding tissues. It also supplies the facial gingiva and part of the nasal cavity. Number 193 is the MSA nerve, and this is a branch of the infraorbital nerve that provides sensation to the maxillary premolars and sometimes the mesiobuccal root of the first molar. Number 194 is the PSA nerve, and this is a branch of the maxillary division of the trigeminal nerve that provides sensation to the maxillary molars, except the mesiobuccal root of the first molar in some cases. 195 is the greater palatine nerve, and this provides sensation to the hard palate and palatal gingiva of the posterior maxillary teeth. Number 196 is the lesser palatine nerve, and this provides sensation to the soft palate. Number 197 is the nasopalatine nerve, and this provides sensation to the anterior hard palate and palatal gingiva of the maxillary anterior teeth.
Hi, I'm Courtney, and I'll be doing numbers 198 through 209 of our school project. Starting off with number 198, the mandibular nerve is the third division of the trigeminal nerve, and it provides both sensory and motor innervation. It exits through the foramen ovale and supplies mandibular teeth, lower face, and muscles of mastication. Next up is number 202, the long buccal nerve. This is a sensory branch of V3 that innervates the cheek and the buccal tissues of the mandibular molars. It runs anteriorly across the ramus. A long buccal nerve is used to anesthetize the buccal soft tissue and mandibular molars during procedures like restorations and extractions. Number 203 is the masseteric nerve. This is a motor branch of V3 that innervates the masseter muscle, which is important for chewing. It travels through the mandibular notch to reach the muscle. This nerve is not typically targeted in dental anesthesia since it does not provide sensory innervation to teeth or soft tissues. Number 204, the auricular temporal nerve, is a sensory branch of V3 that supplies the lateral scalp and areas near the ear. It travels posteriorly around the mandible, and it is not commonly anesthetized in routine dental procedures, but may be affected during posterior mandibular injections. Next up is number 205, the lingual nerve. The lingual nerve is a sensory branch of V3 that innervates the mandibular lingual tissues and anterior 2/3 of the tongue. It runs close to the mandibular third molar region, and it is commonly anesthetized during an IA nerve block, resulting in numbness of the tongue and lingual gingiva. Here we have number 206, the submandibular ganglion. This is a parasympathetic ganglion associated with the lingual nerve and located near the submandibular gland. It is involved in salivary secretion. While not directly targeted with local anesthesia, it is anatomically important because of its close relationship to the lingual nerve. Number 207 is the inferior alveolar nerve. This is a major sensory branch of V3 that innervates all mandibular teeth. It enters the mandibular foramen and travels through the mandibular canal. The inferior alveolar nerve block is one of the most common dental injections used to anesthetize mandibular teeth, as well as the lower lip and chin. Number 208, the mylohyoid nerve, is a motor branch of the inferior alveolar nerve that supplies the mylohyoid muscle and anterior belly of the digastric. It branches off before the IA nerve enters the mandibular foramen. It is not typically anesthetized, but accessory innervation from this nerve can sometimes incomplete anesthesia during an inferior alveolar nerve block. Lastly, number 209, the mental nerve, is a sensory branch of the inferior alveolar nerve that exits through the mental foramen. It supplies the lower lip, chin, and buccal tissues anteriorly. A submental nerve block is used to anesthetize these soft tissues without affecting the mandibular teeth.
My name's Kelsey. I'll be covering numbers 210 through 224, as well as PSA and MSA.
Number 210 is the incisive nerve, which exits through the incisive foramen. It's a branch of the inferior alveolar nerve and provides sensory innervation to the mandibular anterior teeth.
Number 212 is the facial nerve, which exits the skull via the stylomastoid foramen and is the motor nerve for muscles of facial expression and carries taste from the anterior 2/3 of the tongue.
Number 219 is the muscles of facial expression branch of the facial nerve, which controls muscles of facial expression like smiling, frowning, and blinking. Number 221 is the glossopharyngeal nerve, which exits the skull via the jugular foramen. This is for sensory and motor and provides taste for the posterior 1/3 of the tongue, as well as innervates the pharynx and contributes to swallowing. Number 222 is the vagus nerve, which also exits the skull via the jugular foramen and is a major parasympathetic nerve that controls heart rate, digestion, and motor control of the larynx and pharynx for speech and swallowing. 223 is the accessory nerve, which enters via the foramen magnum and exits via the jugular foramen, which provides motor control for the sternocleidomastoid muscles as well as the trapezius for head movement and shoulder elevation. Number 224 is the hypoglossal nerve, which exits via the hypoglossal canal. It's for motor innervation of the tongue muscles for speech and swallowing. The PSA nerve, or the posterior superior alveolar nerve, provides sensory innervation to the maxillary molars except for the mesiobuccal cusp of the first molar. The MSA, or middle superior alveolar nerve, is sensory innervation for the maxillary premolars as well as that mesiobuccal cusp of the first molar.
Hi, I'm Olivia. Here's my skull, and today I'm going to be going over the labels for part 7. ASA numbs the maxillary incisors and canine. AMSA numbs the palatal tissue, molar to incisors, pulpal mesiobuccal cusp of the first molar to incisors, buccal tissue, and premolars to incisors. GP numbs the palatal tissue from molar to premolar. NP numbs the palatal tissue canine to canine. IA numbs pulpal molars to midline and buccal tissues premolars to midline. B numbs molar buccal tissues. L numbs tongue and lingual tissue molars to midline. Gaugates numbs the entire V3 division of the trigeminal nerve. MI numbs pulpal and buccal tissues premolars to midline.